Health insurance has been a big topic, especially with a lot of the news going on these days. And one question that a lot of people are asking, and more people are asking it even today, is why is healthcare, and specifically health insurance, so expensive? I remember going to the emergency room. My son fell off his bike, hurt his mouth. We went to the emergency room, stayed there for a couple hours, and at the end of the visit, ironically, I'm in the health insurance space. I don't really know what plan I have, just like most of our clients. We know what plans our clients have, but when it comes to myself, I'm like, well, I don't have to worry about it. I pay for health insurance. I paid a lot for health insurance. The nurse wheels in the cart and says, it's going to be $5,000. That's your deductible. And would you like to pay via cash or credit? And I don't know who carries on $5,000 in cash these days. I guess people that visit the emergency room. But so I said, well, I guess I'll put it on a credit card. And they were pretty adamant about paying right there and then. And with most Americans not being able to afford a $1,000 bill for emergencies, this is becoming a crisis in the country, where most people, they might be insured, but they can't afford coverage. And so the question is, how did we get this way? How did healthcare become so expensive, and how did health insurance become so expensive? Another story I saw on Twitter or X, there was this woman that posted her bill from the NICU, which is the neonatal intensive care unit. She had her baby needed a lot of assistance, and she was in the NICU for about a month. And that bill came out to be just a little under $1 million, $978,000 for a 30-day stay. And she felt like she was just laying around. I mean, there was a lot of equipment, a lot of things that go on behind the scenes, but that's just the nature of what people are facing today in the US, and healthcare is becoming unaffordable. So I thought it'd be an interesting rabbit hole to go down by starting with the history of health insurance. How did health insurance really start? So in the US, health insurance, I would say the primordial version of health insurance started in the 1700s. The US was really a maritime economy. We went out there, we hunted whales, we fished. Most of the population were on the coasts, and it started out as sailors. They got hurt, they needed care, or they needed disability payments to cover their wages. And health insurance initially started as a tax on the shipping vessels, shipping companies, and so forth to pay for these issues that came up with sailors. And then fast forward to the early 1900s, where health insurance that we know today, employer health insurance, that's when health insurance really started to evolve into what we know as health insurance today. So a couple of stories. One was a group of teachers in Dallas. They wanted to prepay for their health care. Started a group where health insurance essentially became the vessel that they used to they put a little bit of money each in. I think something like 50 cents a month, unheard of numbers today, into their fund every month, and then that would pay for any catastrophic issues that would happen amongst them throughout the year. Also prior to that, hospitals would band together, and before health insurance existed, people relied on charity. A lot of times surgeries, they were done at the home, and a lot of times surgeries and treatments and so forth, they were done by doctors with a license. We don't know. Sometimes you'd have the town doctor come to your house, treat you, and you'd pay them in food or give them a chicken or something like that. So that's what, a lot different from the billing system that we have today. And so hospitals would then say, well, why don't we band together and we'll charge people a monthly subscription, and that way we have predictable cash flow, and folks can have predictable payments, so that it's not something happens, you need to pay a big bill, can you afford it, can't you afford it? And that's essentially what became the first Blue Cross. And then so that, along the Dallas teachers group that started, that's when health insurance really started to take off a little bit. And then also the Kaiser companies, which they weren't always in the hospital business. They were originally in the shipyard business, and they realized that a lot of their employees were getting sick and they couldn't pay for health care, and to basically make sure that they have a viable workforce. So that's when Kaiser started investing in healthcare for employees. So the incentive there was you pay for healthcare, people got better sooner, and people got back to work, and you would get more productivity. So in healthcare back then, it was relatively affordable, a couple dollars a month. Even with the wages that were paid back then, it was very affordable for individuals. And what happened was World War II. World War II came around. A lot of the manufacturers were repurposed for military uses, and also labor was tight because the economy needed people to go and make weapons or go to war, and also prices for wages went up and up and up. And then what the government did was they said, we're going to fix wages, meaning that in order to make it affordable for companies, companies can't pay more than X amount of money for employees. And so companies were still making money. They were getting a lot of revenue from the war and manufacturing and so forth. So companies had excess capital. They couldn't pay anymore based on regulations. So companies started looking at fringe benefits. So fringe benefits are essentially benefits that aren't part of somebody's salary, but are in addition to their salary and their sort of in-kind type of services. And health insurance was one of them. So because companies were flush with money, they were essentially giving away health insurance for no cost, along with other fringe benefits, but health insurance was really one of the big ones. And one of the factors that was overlooked was that essentially gave a blank check to the medical industry. And that meant that doctors could charge what they wanted, hospitals could charge what they wanted, and then also really incentivized innovators to produce new therapies, new tools to be able to provide better healthcare, which was a good thing overall. And we saw the amount of tools that doctors and hospitals, the amount of tools rapidly grew. And that gave birth to the pharmaceutical industry, the medical device industry in the US, which became very powerful industries because of this essentially blank check that employers were writing the medical industry. And I remember even in the 70s and 80s, a lot of the doctors that I talked to that practiced during that time period, they said that was the golden era. And it had people, orthopedic surgeons making, $2-3 million in the 80s. That was a very common thing that happened. So a lot of people were making a lot of money because employers were giving the industry a blank check. And then quickly what happened was, after World War II, there were no longer price fixes for wages. The free market came back in some respects, and companies competed for talent by increasing wages again. And so without price fixes, what happened was things kept on getting more expensive for the companies. And that's compounded to what it is today, where Starbucks pays more for health insurance than it does for coffee beans. So to give you an example. And that hasn't stopped. It's one of the industries where it's not uncommon, even before our inflationary period, to get double-digit increases on health insurance premiums every single year. And that's just normal. 1 year it's like, oh, what's my increase? Your health insurance went up 12% this year. Oh, okay, fine. What can we do? Well, yeah, that's the way it is. Healthcare gets more expensive every year. Let's complain about it next year. But the law of 72, which is 72% of something, that's the compound. That's when things double. If something compounds and it adds up to 72, that's when, with compound interest, things really double. It's not 72%. It's when things double. So with the compound interest of healthcare being double digits almost every single year, the cost of healthcare has now risen greater than really any other industry. So imagine if food prices really went up double digits every single year, or how much you pay for Netflix went up double digits every single year. Nobody would be able to really afford anything. And because healthcare is something that we all need, that's where people are in this predicament, where can we afford it? And that's where the intentions behind the Affordable Care Act, getting everybody insured, good intentions, but in reality, what it did was it added more administration to the industry and it added more costs to the industry. So things just kept on getting more and more expensive. And today, healthcare is about 20% of GDP, which means that for every dollar in the economy, 20 cents of it goes to healthcare. And that's really paid for by the employers, that's paid for by you as an employee, it's paid for by the government through Medicare, Medicaid, through government insurance, the military, the VA, and so forth. And it's becoming a chokehold on the economy where a lot of small businesses, even a lot of big businesses, they're not able to grow or they have to merge because of healthcare expenses. So in the future videos, we're going to go into some of the solutions that are being proposed, but highlighting the problem, really highlighting the history of how we got here is really important, because the takeaway here is we are no longer in a World War II economy where there's price fixes on wages and employers are flush with cash to be able to pay for fringe benefits. So we really have to look at the structure of healthcare and how we're paying for healthcare in a different lens in order to really solve this puzzle. Otherwise, it's going to get to a point where it's just going to be unaffordable for all.